Over the last couple of weeks, we've been sharing stories from people facing cancer, but this morning we're getting a different view.
Canadian Cancer Society funded researcher and associate professor at TMU, Dr. April Khademi. She joins us now with how she's using AI in her research. Welcome back to the morning show.
Thank you very much for having me again.
So your research is an area that is developing so quickly. We're talking AI. Explain how you're using artificial intelligence.
Sure. So just to give you some context, medical imaging is a critical piece of the patient pathway. So when a patient goes to see their doctor, usually one of the first tests that they order is medical imaging. And based on that medical image, a radiologist or pathologist would visually assess and interpret the image. And from there, they would provide a score or grade, and these scores or grades are used to decide therapy. So for example, a grade 3 breast cancer, the pathologist and the oncologist might decide to assign adjuvant chemotherapy. So it's a critical piece of deciding therapy for patients. The challenge is, as with any human-based analysis, is that visual assessment is subjective. What that means is you could have 10 pathologists and radiologists looking at the same image and coming up with 10 different answers. And since those answers are used to decide therapy, that means that the patient could receive 10 different therapeutic options. This can drastically reduce quality of care.
Sure.
So in my lab, we're focused on overcoming these challenges through building AI solutions for medical imaging. Our tools are meant to interrogate and extract insights from medical images and to quantify things in a clinically meaningful way. So instead of eyeballing measurements from images, we can provide precise measurements of disease, such as how many cells and the size of tumors in milliliters, and these can lead to better therapeutic decision making.
Okay, now we know you've been working with AI for a number of years now. Can you tell us a bit about some of the results you're seeing?
Yes, sure. That's great. So we conducted a study with 100 international pathologists. We gave them the image without AI and the image with AI. And what we found is when the doctors adopted the AI, they became 20% more accurate and 12% faster. But more excitingly, I would say, is that all the pathologists agreed with each other. So what does that mean? That means you can have a resident pathologist, a practicing pathologist, a pathologist from rural Ontario or an academic center, and they all come up with the same decision, which leads to the same therapeutic decisions. And we studied this further in that we published a study with the American Association of Cancer Research, and we showed that with AI, only 66% of the pathologists would assign the correct therapy. That means that women with breast cancer might not get chemotherapy that need it, or women that don't need it would get chemotherapy, which is obviously not good. But with AI, this number jumped up to 97%, which indicates that almost 100% of the patients would receive the correct therapeutic decision, which leads to better quality of care. So in essence, with AI, we're able to standardize decision making, which leads to better patient outcomes.
So incredibly important research that is being done, and these findings. Your funding comes from the Canadian Cancer Society. So speak to us about the importance of donations.
Yes. So research takes a long time, but research can save lives. But in order for us to do that research, we need funding. Researchers like me need continuous funding to do the work. So the funds from funders such as Canadian Cancer Society will fund experiments, allow me to collaborate with clinicians, helps for me to gain access to data and computers to do the work that we need to do. And this allows us to advance breakthroughs and allows patients to spend more times with their loved ones.
Sure. All right. Well, obviously that funding, very critical, very important, and got just about a minute left here, Doctor, but wanted to ask you, since we've been talking about AI, just how beneficial it is, where do you see it going from here when it comes to your research?
Yeah, so that's a great question. So I feel like we're really starting to get somewhere, and I'm super excited. And we've come a long way. When I was doing my PhD several years back, I was working in the same space, and I worked at a doctor's office. And I remember telling the doctors that I'm going to design software tools that read medical images. And they told me, oh, I would never use that. And so I remember kind of second-guessing my career decision and what path I was taking. But I was super excited by the potential of the technology, and I kept it going on. And fast forward to today, we're starting to deploy these tools with pathologists. You can think about it as a software-based toolbox that arms the clinician with metrics they need to do the job that they do better.
Yeah. Well, thank goodness you continue down that path, because we benefit for it. Thank you, Dr. Khademi, for coming in.
Thank you so much.
All right.
This portion of the morning show is brought to you by the Canadian Cancer Society. Donate at cancer.ca/holiday.